Hi, my name is Jan Lavinge. Welcome to our Chairside Chat. I'm here to talk with Dr. Elaine Cebuliak about the herbal formula Essiac. Dr. Elaine is a veterinarian and researcher with a special interest in holistic and complementary medicine. Welcome, Dr. Elaine.
Hi Jan, thank you for having me. It's a pleasure to be here today.
Doctor, on reading through your notes, the statement made some years ago by Reen Case really made quite an impact on me. And if I could quote Reen's statement before we begin, "There is no cure for cancer, there never will be. There are only cures for people who have cancer."
Thank you, Jan. That's one of my favourite quotes as well. It reminds me of something that Paracelsus said, who was a 16th century philosopher and physician. And he said, "Those who merely study and treat the effects of disease are like those who imagine they can drive away the winter by brushing the snow from the door. It is not the snow that causes the winter, but the winter that causes the snow." And I find that allopathic or Western medicine can sometimes be symptomatically based. You have a cough, so you go to the doctor and the doctor gives you something to relieve the cough, when in fact there may be a lot of other underlying reasons that a holistic practitioner might find to try and make the patient heal more appropriately and come back into balance. So I do find that when we're looking at the Essiac formula and other types of herbal medicines, we have a balance happening, trying to make the body heal itself rather than just treat a particular symptom, such as cancer.
So, could you now explain to our listeners how Nurse Reen Case first obtained the Essiac formula and why it's called Essiac?
Right, thank you. It's a very interesting story. Nurse Reen Case was practicing in Ontario, Canada in the early 1920s, and one of her patients had a shriveled breast and explained to Reen that she had been identified and diagnosed as having breast cancer at that time. In those days, there was very little that Western medicine could do other than a mastectomy, and not wishing to have a mastectomy, this particular patient went back to her mining town and met up with an Indian herbal formula through one of the Ojibwe or Chippewa tribes, and she drank this herbal tea several weeks in a row and ended up with her breast cancer shrinking and then reducing and going away entirely. So Reen was very happy to learn about this particular formula, thinking that she might be able to use it if she herself or any of her immediate family came down with cancer. And she copied this formula and went to the Indian tribe and learned how to wildcraft or collect these herbs and make them into a tea. And not long after she discovered this formula, her own aunt came down with stomach cancer, and she was able to then make this tea and help her aunt to heal herself from cancer.
So Essiac is the name given to the original formula.
That's correct. It's actually Reen's name spelt backwards. So Reen's last name was Caisse, and she named her formula Essiac after her own name.
Well, Doctor, could you give our listeners a little background history and some possible methods of action on formulas such as Essiac?
Yes, Essiac is a herbal formula that has been used by many different cultures around the world, in Northern American Indian tribes and in Chinese, Japanese and Ayurvedic Indian herbal formulae. The cross-cultural commonality leads one to speculate about and to further research its ingredients and methods of action. Essiac was tested at both the Memorial Sloan Kettering Institute and the U.S. National Cancer Institutes in the 1970s, and at that time there was some political activity, and it was stated that there was no anti-cancer activity in animals then. But during this period, Reen Case was lobbying for it to have a further fair trial. I will actually talk about some of the politics behind this apparent negative outcomes of these studies later on, these so-called Essiac trials that really didn't have fair consideration.
Dr. Elaine, would it be right to assume more people, including practitioners, are becoming aware of the Essiac formula?
Yes, that's correct. Although Essiac is an ancient formula, it was recently brought to the attention of some of the Western doctors and veterinarians through some of the network marketing, research and development companies.
So, Doctor, could I now ask you to share a little about Reen Case's dedication to using the Essiac formula in her clinical work?
Certainly. From 1922 to about 1978, Nurse Case helped thousands of people with her Essiac herbal supplement at her clinic in Bracebridge, Ontario, Canada. Although she refused payments for her services, she did accept donations to help support her clinic. Doctors referred cases to her that could no longer be helped with traditional Western health care. Nurse Case devoted her life to using the Essiac formula and helping the suffering. She used her sheep sorrel solution topically, as an enema, and as a mouthwash.
How many main herbs are contained in Essiac?
There are 4 herbs in the formula. These are burdock, sheep sorrel, turkey rhubarb, and slippery elm.
So could you give our listeners an overview of the nutritional value and the benefits and some of the active ingredients of these herbs? Perhaps we can begin with burdock.
Okay, burdock is also called Arctium lapa. It's a traditional Asian food known as gobo, or an Asian vegetable. This long root is packed with many minerals such as iron, chromium, magnesium, silicone, calcium and potassium, although the quantity of the individual minerals would of course depend upon the soil content where it is grown. Burdock root is generally cooked, scrubbed well but not peeled, and the skin contains the nutrition and flavour part. It is steamed and stir-fried and added as a condiment, eaten often with fish and with meat.
So how safe would you say burdock is?
Very safe. In fact, quite recently there's been a patent taken out in the United States to add cooked burdock root into baby foods. Burdock has many uses. The American Indians used to use the roots dried for winter food, and the young leaves were cooked to eat. As a medicine, it was called a blood purifier and a cleanser. The root was used for stomach pain by the Ojibwa tribe, as well as what they called a blood cleanser. The dry cough at wintertime was treated with a leaf infusion tea. It has been shown recently to have antiviral properties. In fact, it has been used against the immunodeficiency virus HIV. In cancer care, it has been shown to decrease the inflammation, and there is a very strong anti-inflammatory action to this herb. An anti-mutation factor has also been isolated, which is both resistant to heat and protein-digesting enzymes. Scientists at the Kawasaki Medical School in Okayama, Japan, call this the burdock factor. In cancer palliation care, it can be of benefit for its well-being effect alone. It's known traditionally for treating the stomach pains, cramps, inflammation, in fact anywhere where there is an inflammatory condition. The active ingredients of burdock have been isolated separately, and there are hundreds of different ingredients in this food substance. Some of the main ones include arctigenin, which is anti-inflammatory and a free radical scavenger and neuroprotective chemical. Arctigenin has been isolated in very many different scientific trials in Korea and Japan. It has been shown to have cytotoxicity and anti-tumor activity, and some of its other factors, arctigenin, can be broken into arctein, which is spelled Arctiin, and this is one of the active ingredients in the gobo plant. It's also anti-estrogenic, and a study that was shown that arctein, which is a lignin, will actually influence the hepatocarcinogenesis in a study using rats. It's orally effective, so if it is given in gastric juice, which has a very low acidic pH, the arctein is transformed to arctigenin, and then it is actually more effective when it's taken orally. Inulin is another ingredient of burdock root. It's also found in dandelion root, chicory root, and some other Chinese herbs such as Codonopsis. Inulin is a fructooligosaccharide, and it's been well documented that if you have these type of oligosaccharides in your intestines, then you will be able to give the bacteria that are beneficial in your lower bowel the right substrate to make the right type of bacteria. So it improves the balance of your friendly gut bacteria. It has also been shown to prevent metastases. That's when, if there is a cancer cell, it spreads to other parts of your body or metastasizes. So it's been shown that ingredients of the burdock root will decrease the rate of metastasis. It also causes apoptosis or apoptosis. This is programmed cell death. This is something that is lacking in cancer cells. They don't know when to stop growing. So the raein ingredient in the burdock root is able to induce the apoptosis. Cancer prevention is a very big thing that we would all like to be able to do, and wouldn't it be great to have something that's a simple herb that you could add to your diet that could help prevent the cancer from forming in the first place, and then stop it from spreading if you do happen to have it, and then take away some of the pain and the inflammation associated with it. So that's enough for burdock root, I think, for now.
That sounds like a wonderful herb. Now would you like to share some benefits on slippery elm bark?
Certainly. Slippery elm bark is known for its demulcent activities in the intestine. It's very soothing. So if there is diarrhea or vomiting, slippery elm is traditionally used for those sorts of things. It contains tannins and mucilages, which help to dissipate the mucus deposits in tissues, glands, and nerve channels. The inner bark is also very rich in trace minerals, calcium, magnesium, and certain vitamins, vitamin A, B, C, and K. So it nourishes and soothes organs. Very useful for things like coughs and irritable bowel.
Now, moving on to the benefits of the third of these herbs you mentioned, sheep sorrel. Could you also tell our listeners some of the several common names with which it identifies?
Yes, sheep sorrel is known by a number of different common names. These are field sorrel, red weed, sour dock, sour grass, dog-eared sorrel, etc. So it's important if you were to go and wildcraft or pick herbs that you were able to identify correctly what this herb is. Therefore, you would probably be best to purchase the ingredients made into a tablet form or already made up into a tea so that you don't make a mistake and get something that could potentially be toxic.
So, Dr. Elaine, are there any other chemicals in sheep sorrel that have been shown to be of benefit?
Yes, sheep sorrel actually contains emodin, and emodin has been shown to have significant anti-leukemic activity. Emodin is also in buckthorn and rhubarb and can be a laxative. The benefits of emodin have been that it inhibits cytokines that are active in causing inflammation, tumour spread, and metastases. Sounds a bit like rain, doesn't it, Jan? So a lot of the different chemicals that are found in the 4 herbs have synergy and similar effects. So you can see that they can be more powerful when combined together.
Well, now, the last herb in the formula is the rhubarb root. Do all rhubarb plants have similar benefits?
Indian rhubarb, or Rheum officinale, is the main herb that was cited in Reen Case's formula, but there is also Rheum palmatum, and it is believed that the Chinese used the palmatum for a variety of their anti-cancer nutritional treatments.
And is it true that rhubarb has been described as a phytoestrogen?
Yes, that's correct. In a recent study by the Clinical Research Institute, Center for Endocrine and Metabolic Disease in Kyoto, Japan, they found that a rhubarb extract exhibited phytoestrogen effects on male fish. The male fish, Medaka or Oryzius species, exhibited female characteristics given the phytoestrogens extracted from the rhubarb. They concluded that the ingredient, which was called lindlein, which was a component of many other herbal medicines, was a novel phytoestrogen and might trigger many of the biological responses evoked by this physiological estrogen.
And Doctor, what are some of the personal veterinary experiences you've had using an Essiac type formula?
I think that the Essiac formula, particularly in tablet form, is a wonderful thing that all veterinarians should be looking at having and stocking on their shelves. I've had many cases where animals have severe tumours that are bleeding, ulcerating, causing a lot of pain, and the owners have a financial constraint or have already exhausted the possibility of Western healthcare, which includes radical surgery, etc., and chemotherapy, and they really don't have any other options. And to have something like Essiac on your shelf where you can cause regression, remove some of the pain, stop bleeding, help with ulcers, is just a wonderful thing to have. I've been able to use this Essiac formula in nasal adenocarcinoma in a 12-year-old boxer, where we were able to obtain regression within 2 months of using the Essiac formula. Many mice and rats I've used, these have sarcomas, aggressive tumours, and these little mice and rats, often they come to me and there is more tumour than there is mice or rat, and after just 1 week using about 1 tablet of the Essiac per animal per day for around 7 days, we have a very good compliance rate. The animals like to eat these tablets and they feel better, they start gaining condition again, and they get some tumour regression. I've also used it on cats with nasal adenocarcinoma, cats that have severe periodontal lesions and inflammation at the back of their throats. And the compliance rate for these are fairly good, but when we're dealing with cats, it can be difficult to medicate at the best of times, and sore mouths. We certainly want to rule out dental disease, such as feline odontoclastic resorptive lesions, where some of these teeth have holes in them and they really do need to be removed surgically. So we want to look at the total picture of what is going on in these animals, and it's very nice to have this as an adjunct on your shelf.
As reassurance for our listeners, could you now share some of Reen's historical treatments and experiences?
Certainly. There are many documented cases of people becoming cured of their cancer by the use of the Essiac formula. Dr. Charles Bruch, who is a medical doctor that worked with Reen, said that the results we obtained with thousands of patients of various races, sexes and ages with all types of cancer definitely proves Essiac to be a cure for cancer. They had done studies in 4 laboratories in the United States and Canada, and these fortified his claim. Charles Bruch was the President John F. Kennedy's personal doctor. The medical establishment held him in high esteem, and the Bruch Medical Center is one of the largest medical clinics in Massachusetts. He was the first physician to administer a polio vaccine in the United States. He was a unique humanitarian. He had studied acupuncture and had set up the first clinic in the USA to conduct acupuncture research, using it in his clinic in 1959. He was the first doctor in the Western Hemisphere to initiate a medical benefits plan for medical help, and he was interested in preventive medicine, nutrition, and other forms of natural treatment.
Dr. Elaine, did politics become an issue in the work Reen and the Bruch Medical Centre were undertaking?
It certainly seems to be that is the case. When you read some of the research and the writings of Dr. Bruch and Reen Case, it suggests that there was something going on with the Memorial Sloan Kettering Institute in New York that was going to be used to trial the herbs and the mice. The National Cancer Institute also wished to perform the studies, but they both wanted Reen to disclose her formula, and she refused to do this because she did not want the formula to become a patented, unobtainable, or unaffordable medicine to those cancer sufferers that she was treating. This meant that Reen alone was responsible for brewing and concocting the tea that she then distributed to the clinics for the trials. When she was working at the Bruch Medical Centre, this probably wasn't much of a problem, but when she went back to Ontario, they had to actually ship the herbal teas down to the Bruch Medical Centre in Massachusetts. And there does seem to be some problems there. Although the studies with the mice showed favourable results, the 2 institutes that were providing the mice and their histological reports suddenly stopped, and they stopped supplying it. So it was clear to Dr. Bruch and Reen that it forbade its members to refer patients to them to use so-called unknown remedies. This stand by the powerful, pharmaceutically led cartel financing the research had been repeated many times. Another story that's worth relating sometime is the amygdalin or vitamin B17 laetrile story, where an eminent researcher called Kanematsu Suguri had his work stymied by the board of directors as well, and they dismissed their senior researcher at the hospital, Ralph Moss. It's a very interesting story. You can research through the net and find out more about Ralph Moss.
So where could listeners obtain more information on Reen case?
There is quite a lot of information out there now. You can actually obtain some audio cassettes of Reen herself being interviewed by the Brisbane Corporation, and an internet search using the words Essiac, Essiac. You'll be able to pull up quite a lot of information there. And there are books in the library as well.
Great. So was there a reason the Essiac trials failed to become a patented success in Reen case's day?
I believe there's probably many reasons for that to have been the case. Reen was a remarkable woman, but she did want to have control over the whole production. And as we said previously, it may be that she was concerned that the price of the Essiac was going to be unaffordable for the people that had cancer that she wanted to have treatment. And it does appear as though that some of the research showed promising results, and then what they documented and put out towards the press was basically a negative effect, stating that they didn't see that it was a cure for cancer, and yet there are hundreds of patients that are well documented with adequate information about their cancer being documented scientifically, that have then gone on to live many years, 20 or more years, following their treatment with the Essiac formula. The work that I've been able to do has been able to be documented, where I can see these animals are well benefited by the use of the Essiac formula, and in the last 5 to 10 years where we've been able to isolate the individual ingredients such as octogenin, octein, rain, emodin, and the phytoestrogens that are within the formula, we now have scientific evidence that explains how the Essiac formula can work.
Can Essiac trials be performed on people in the drug-like placebo-controlled manner?
I think this is always a difficult area because it's clear that Reen was dishing out nutritional advice, emotional support and Christian faith while also giving her tea. It was aimed at maintaining a good nutritional balance and a high vegetable fibre intake in order to have a healthy bowel function. This of course makes placebo-controlled double-blind studies on these patients difficult. Her holistic advice was in consideration of the whole patient, body, mind and spirit. Nutrition and elimination were seen to be paramount for good health, as well as a good personal attitude and a belief system. The trials held at the Sloan Kettering Institute were, however, quite a success in treating mice with cancer, according to Dr. Bruce, but these were not reported to be a success in the National Cancer Institute studies. When Reen further supplied extracts for these studies as requested, she felt that they were not a laboratory success due to the storage techniques that they were using.
So, Dr. Elaine, what was Reen's philosophy?
Reen understood the principles of holism, which is perhaps why her formula could not be adequately tested. Using Essiac alone, without dietary changes and lifestyle considerations, was perhaps not what she would want her patients to do, as it may make them suffer needlessly when she knew they might need the whole package of treatment. She would state things like, the majority of cancer patients that fail to overcome are those who pay too little attention to detoxification and elimination. She'd say that toxins kill, that toxins poison the muscle of the intestinal wall and impair the ability to contract and force out the fecal matter. Possibly the most effective way to detoxify was by fasting, so it's clear that she probably had them do other things besides the Essiac formula.
From what our listeners have heard, it appears that a balanced approach is certainly the order of the day. Can you offer our listeners your expert advice?
I certainly do think that a balanced approach is very important. Those of us that practice holistic medicine recognise that there are many mitigating factors to a disease process. Factors that may cause an overall ill health pattern in individuals are varied. They may include things such as leaky gut syndrome or small intestine bowel overgrowth and irritable bowel disease. Things like colorings, preservatives in food causing allergies, pesticides and herbicides that act as xenoestrogens, vitamin, mineral, amino acid and fatty acid imbalances in the diet, things like serotonin and endorphin emotional links which require behavioral management are also important. The ideal treatment of a patient would take into consideration all of these disparities and attempt to treat the source. This may include supplementing with a variety of things, such as nutritional supplements that contain, say, omega-3 fatty acids found in salmon oil and flaxseed oil, trace colloidal minerals, specifically selenium, zinc, some copper, some calcium, some boron and magnesium, and essential amino acids that are in, say, organ meats, particularly for cats, for instance, taurine and lysine. And it would be useful to employ things such as acupuncture and other types of body work, such as shiatsu, Bowen therapy, or massage, to release that tension in those muscles to provide a smoother movement and flow of energy, or qi as the Chinese call it. It would be useful to provide nutritionally sound and balanced food, but of a calorie-restricted optimum. So much of the disease in today's society, Jan, as you would be aware, is obesity. And when we have an obese body, we have a difficulty of the nutrition getting through to the muscles and to have the muscles work appropriately. There have been quite good studies that show a calorie-restricted optimum nutrition, or CRON diet, will lead to longevity. We also can use things such as herbal supplements for supportive treatment, such as Essiac or the Hoxie formula or Chinese mushroom extracts, and strong antioxidants such as coenzyme Q10. They all have various functions, and they can all be helpful in detoxifying and being used as an anti-inflammatory agent or an antioxidant.
And Dr. Elaine, for many, there's often a dilemma in choosing when it comes to Western traditional medicine versus complementary alternative therapies. Could you share your views on this?
Yes, certainly. Clearly, with my Western medical training, it's very important that we do use this medicine appropriately. When there is, say, a tumour that can be completely surgically excised with clear margins, then that's a very important thing to do. I certainly wouldn't be ignoring a melanoma on a person's skin when it can be excised completely and lead to complete recovery. But as an adjunctive aid, when the surgery boundaries are not clear and you can't remove all of the cancer, or when there's metastases present, or when the chemotherapeutic side effects are of a concern to the patient or the owner of that particular dog or cat, or when there's a possibility of having a toxic environmental contamination using chemotherapy and the owner does not wish their family to contact this, or when there is a cost issue to the owner to treat their own animal with the surgery and chemotherapy that may be indicated, then it would certainly make sound sense to use something like an Essiac formula in addition to its pet's well-being and nutritional care.
So, Dr. Cebuliak, why is it important, in your opinion, for practitioners to become educated in complementary medicine?
I think it's important for practitioners to study herbal formula and what naturopaths are doing, because in the pet owning world, many of our pet owners are using these complementary and alternative medicines for themselves, and they would like to use these on their animals. So therefore it's important that vets become educated into using these. Also because there are interactions of some of these herbal medicines with, for instance, Western healthcare and amongst the individual components themselves. For instance, if an animal or a person is on vitamin E, ginkgo biloba, fish oil, and Essiac, these are all antiplatelet factors. They may induce purpura or decreased blood clotting. They might end up with epistaxis, which is bleeding from the nose, or maybe even optic hemorrhage. And it's important to know that if these animals are on these things and we want to give them, say, a drug such as carprofen or a penticin injection for some arthritis, we don't want to tip the balance and make them have some bleeding.
So it becomes the responsibility of both the practitioner and the owner in that case.
That's correct. I think owners should take a large responsibility for their pets' wellness, and that means they do need to become a bit educated. And fortunately, with the internet now and with modern audio cassettes and CDs that are available and short lectures that are available through, say, some of the better-known network marketing industries, owners can become educated fairly easily.
Well, Dr. Elaine, as we come to a close, I'm sure one very important question to you from our listeners would be, are there any side effects with Essiac?
Yes, there certainly are. Just about every Western component and normal nutritional component, even eating prawns, can have side effects in some individuals. Essiac is a combination herbal therapy given orally at the right correct dose, has not been known to have any severe adverse side effects. However, any person or any animal can become allergic to particular ingredients, and things like Indian rhubarb root has been known to increase bowel movements. So if an animal has irritable bowel and has some diarrhea, it may not be the most appropriate thing. It does seem to be very helpful if it's an upper gastrointestinal problem, though, and it can be helpful if there is Helicobacter, for instance. Helicobacter pylori is the actual bacteria that causes stomach ulcers. So I think it's pretty safe for anything from the upper gastrointestinal tract. But perhaps if there is a lower bowel problem, it may not be the first line of choice.
Mm-hmm. So not harmful in so much as just needing a little more care in some cases.
That's correct. I think that if an animal has an underlying problem such as kidney failure or renal failure, you'll want to be aware that there may be some oxalates in, say, the room, and we want to be able to monitor that animal. So some blood testing before for blood urea concentration and creatinine, and careful monitoring, and just look carefully at the dose rate that is being given is appropriate.
Well, Dr. Elaine, I'm sure the main question that everyone will ask is Essiac a cure for cancer?
I think that's very interesting. I don't think that Reen made the claim that it was an overall panacea for all cancers. Certainly, some of Reen's patients and Dr. Bruce have said that Essiac is a cure for cancer. However, what Reen has maintained was that Essiac can cause regression in some of the cancers and certainly helps prolong life.
Please contact the person who gave you this recording for more copies or further information.